Namaskar, pranam, sat sri akal, vanakkam, good morning from America, good evening in the rest of the world, especially India. आपका हम स्वागत करते हैं सृजनी के मंच पर। आज के इस उपलक्ष्य में, इस उत्सव में, इस महोत्सव में हम आपके लिए लेके आए हैं एक खास वजह, एक जीने की तमन्ना, एक जिसे कहते हैं एक कॉज, अ पर्पस, अ मिशन। हमेशा हम करते हैं गीत, संगीत, नृत्य और वादन, कितनी अच्छी अच्छी बातें करते हैं, लेकिन आज हमारे जीने का एक मकसद, हमारे शो का एक पर्पस, एक मिशन है, एक नोबल गोल है। आप आज ना सिर्फ मनोरंजन पाएंगे, लेकिन पाएंगे एक ऐसी वजह, एक ऐसी मंशा, एक ऐसा मंतव्य, अ टारगेट, अ गोल, जो आपको बताएगा कि इस पैंडेमिक, इस महामारी के दौर हम एक गिलहरी के रूप में, एक छोटे से प्रयास के रूप में क्या कुछ नहीं कर सकते हैं। जी हाँ, वो कहते हैं माधव सेवा ही मानव सेवा है। कहते हैं हम ईश्वर के पास जाते हैं भक्ति के लिए, प्रार्थना के लिए, लेकिन अगर हम मानव सेवा करें, मानवता की सेवा करें, वो सबसे बड़ी पूजा होती है। तो आइए आज शुरू करते हैं। वो कहते हैं जरूरी नहीं कि हर वक्त जुबान पर भगवान का नाम आए। वो लम्हा भक्ति बन जाता है जब इंसान के काम आए। तो प्रणाम, नमस्कार करते हैं। आइए शुरुआत करते हैं आज के इस कार्यक्रम की, जहां हम जानेंगे ऐसे हॉस्पिटल के बारे में जहां किसी भी मरीज से एक पैसा नहीं लिया जाता, लेकिन पूरी चिकित्सा की जाती है। और कैसे, क्यों, कब, कहां, व्हेन, व्हाट, हाउ एंड हाउ इज इट बीइंग हैपनिंग, आइए हम देखते हैं आज के सृजनी के इस मंच पर। वेलकम टू सृजनी एंड वी टॉक अबाउट सरला मेमोरियल हॉस्पिटल इन जस्ट अ शॉर्ट व्हाइल। जैसे मैंने कहा था, आज हम एक बहुत बड़ी बात करने वाले हैं। कम शब्दों में, कम समय में हम छुएंगे उस मर्म को, उस मौजू को, सब्जेक्ट को, जो हम सबको जानना बहुत जरूरी है। रिसेंटली वी वर हिट बाय पैंडेमिक। महामारी ने हमको अपनी चपेट में लिया था, लेकिन हमने किया क्या? कुछ लोगों ने शिकायतें की, कुछ लोग रोए, कुछ लोग दुखी हुए, कुछ लोग बीमार पड़े, लेकिन हम अपनी ओर से, हमारी तरफ से हमने ऐसा क्या प्रयास किया जिससे कि स्थिति, परिस्थिति, मनस्थिति लोगों की बेहतर हो सके? आपने कुछ किया, मैंने कुछ किया, चलिए इस बात पर सोचें। लेकिन हाँ, मैं जानती हूँ कुछ लोग ऐसे हैं, दे आर फ्यू पीपल, नोबल पीपल, जिन्होंने सब कुछ छोड़कर, अपनी समृद्धि, अपने प्रभुत्व, अपना ऐशो आराम की जिंदगी छोड़कर उन्होंने चुना उस कष्टकर पथ को, जिसमें आने वाली पीढ़ी, आने वाले लोगों का भला हो सके। तो आइए मिलते हैं ऐसे ही लोगों के साथ। सबसे पहले आई वुड लाइक टू इंट्रोड्यूस यू टू डॉक्टर सनी आनंद फ्रॉम स्टैनफोर्ड। हम उनके बारे में और बताएंगे। हम मिलना चाहेंगे अनु जगदीश जी के साथ, और मिलेंगे बीवी जगदीश जी सर जी के साथ, जो रहते हैं सैटोगा में, एंड हम उनके बारे में भी आपको बताएंगे। आइए मिलते हैं सुंदर कामत जी के साथ। वेलकम डॉक्टर सुंदर कामत जी टू सृजनी when we're talking about सरला मेमोरियल हॉस्पिटल। एंड हम आपके साथ और मिलाएंगे हमारे संगीतज्ञों को, जो हमको देंगे मनोरंजन की एक ऐसी घड़ी जिससे हम जान पाएंगे कि वाकई मन की शक्ति कितनी मायने रखती है, कितनी स्ट्रांग रखती है। सो आप सबका सृजनी के मंच पर, वी वेलकम यू ऑल टू द प्लेटफॉर्म ऑफ सृजनी, एंड वी आर कनेक्टेड टू मोर देन 25 people, global audience around the world. Welcome everybody, and we look forward to learn from you more about Sarla Memorial Hospital. We have learned that people have spent lakhs, millions, and so much of amount to get treated themselves, their families, but it's really enriching, enchanting, and very motivating to know that there is a place somewhere in India, and especially rural India, where a person, if, I mean, God forbid, if anybody falls sick, they can get themselves treated, get medicines and all the resources, all the facilities for no cost at all. I was like, odd. Can it be possible? How did you make this happen? Let's talk to the makers of this hospital and the people who have made all this dream possible. Yes, we can do it if we want it. So, सर्वप्रथम मैं स्वागत करती हूँ डॉक्टर सनी आनंद जी का, जो आकर हमें बताएंगे how did it all started? Why did he think about joining this cause? What made him? And I'll also like to tell you a little bit more about Dr. Sani Anand ji. Dr. K.J. Sani Anand is an award-winning physician, research scientist, advocate, and public health activist who is dedicated to improving the care of children in infancy and early childhood. He currently serves on the nominating committee for the Nobel Prize in Medicine and Physiology. So such an eminent dignitary, eminent personality working towards something that's very important that we all should need to know. Dr. Sani Anand ji, welcome to Srijani, and we would like to know what made you think about this cause? You can do so many other activities like in Stanford and Bay Area in US, but you chose the rural part of India to do something so noble, so big, so something that is so far reaching. Foresightedness. तो हम जानना चाहेंगे आपसे कि what made you think of this project, and let us know about something more about this project. Welcome.
Thank you, Archana ji. This is a wonderful program that you have put together. And I became involved with the Sarla Memorial Hospital about a year ago. The hospital was actually inaugurated 2 years ago, and they had been serving the rural poor completely free of cost, but they only had outpatient facilities. And when the COVID hit, जैसे आप जानते हैं, 32 million people in India have had COVID, and more than 428,000 have died from it. But this is only the official numbers. जो WHO estimate करता है, about 1.4 million people have died. कहाँ पे हैं ये लोग? The 1 million people who are missing, they are in the rural areas, जहाँ कोई हेल्थ केयर एक्सेस नहीं है, जहाँ किसी को चिकित्सा मिलती नहीं है, और कोई अभागा अगर शहर में चला भी जाए तो उसको लाइनों में खड़ा करते या पार्किंग लॉट में ही उसका देहांत हो जाता है. ऐसी दुर्दशा हुई है जिसका हम कभी अनुमान भी नहीं कर सकते. सो ये एक अस्पताल है जहाँ पे कंप्लीटली फ्री ऑफ कॉस्ट चिकित्सा हो रही थी आउटपेशेंट तौर पे, और इन्होंने डिसाइड किया कि नहीं, हमें इन पेशेंट भी करना है. सो एक बड़ा एक्सपेंशन हुआ है, 63,000 स्क्वायर फीट का एक्सपेंशन हुआ है, जहाँ पे 150 बेड्स होंगे, जिसमें से 25 बेड्स होंगे आईसीयू केयर के लिए, और 125 बेड्स होंगे हाई डिपेंडेंसी यूनिट्स. सो जहाँ पे पाइपिंग, ऑक्सीजन, हॉस्पिटल का अपना ऑक्सीजन प्लांट है जो सेटअप हो रहा है, ऑक्सीजन सबको मिल सके, और 4 ऑपरेशन थिएटर होंगे. बहुत बहुत बढ़िया फैसिलिटी है. मैं इस अस्पताल में 3-4 बार गया हूँ इसी साल में, और इतना मन को इतना खुशी उल्लास मिला है इस हॉस्पिटल जाके कि आपको मैं डिस्क्राइब भी नहीं कर सकता.
That's great. That's amazing. And I'll also like to share one document that has come to my notice. तो मैं वो भी दिखाना चाहूंगी हमारे. We would like to show that document as well, and so that you can see that and explain us, help us understand better. Give me 1 second so that we can get that document going. There you go. Are you able to see my screen?
Yes.
Perfect. Yeah.
So ये है अस्पताल. इसका इनॉग्रेशन हुआ था गुरु पूर्णिमा के दिन 24 जुलाई, on Saturday 24th of July. And इसको बनाने में पिछले 3 महीने में इतने वॉलंटियर्स, इतने लोग लगे हैं कि 3 महीने में ये इमारत खड़ी हो गई है.
Wow.
Please scroll down.
Sure.
So ये इनॉग्रेशन की कुछ फोटोग्राफ्स हैं. दिस इज द वाइड एंगल व्यू जो आपने अभी फिलहाल देखा. वाइड एंगल व्यू, बहुत सुंदर फैसिलिटी है. और जो रूरल लोग आते हैं, किसी से कुछ नाम पता नहीं पूछते, सिर्फ पूछते हैं आपको क्या तकलीफ है, हम कैसे आपकी सेवा करें. और इतने आदर से, इतने पेशेंस के साथ, इत्मीनान के साथ उनकी चिकित्सा होती है, उनकी देखभाल होती है. और अगर नीचे देखें तो आपको मिलेगा जो इनॉग्रेशन की फोटोग्राफ्स हैं. देखिए.
Perfect.
हाँ, ये इनॉग्रेशन की फोटोग्राफ्स हैं. ये श्री मधुसूदन साईं हैं जिन्होंने इसको इंस्पायर किया है. और नीचे देखिए जरा.
बिल्कुल.
हाँ, ये सारे गणेश स्तुति हुई थी. अच्छा, अब यहाँ देखते हैं हम अस्पताल में ना सिर्फ 4 ऑपरेशन थिएटर हैं, बट एक लेबर एंड डिलीवरी वार्ड भी है. और उसके साथ साथ न्यूबॉर्न आईसीयू, नए पैदा हुए बच्चों के लिए आईसीयू बना है. बहुत सुंदर आधुनिक तरीके पर ये बना है और लेटेस्ट इक्विपमेंट इस जगह में है। और साथ में जो राइट साइड पे आप देख रहे हैं ये है पोस्टनेटल वार्ड, जहाँ पे माँ अपने बच्चे से ज्यादा दूर नहीं होगी, पास ही जा सकती है, कभी भी जा सकती है अपने बच्चे के साथ। और
Amazing.
हाँ, थोड़ा नीचे करिए। ये देखिए क्या क्या हालत थी। 19 जुलाई को ये हालत थी और फिर इनॉग्रेशन के दिन ये ने एक हॉलवे की तस्वीर है और नीचे बॉटम रो में देखेंगे ये न्यूबॉर्न आईसीयू, नियोनेटल आईसीयू जो है बिल्कुल ऐसे अनफिनिश्ड था, बट दिन रात लोगों ने काम किया है, वॉर फुटिंग पे काम हुआ है और 24 जुलाई तक ये सारा इक्विपमेंट भी टेस्ट होके और लग गया था, फंक्शनल हो गया। अब और थोड़ा नीचे देखिए।
Sure.
ये है पोस्टनेटल वार्ड। इसकी क्या दशा थी उस वक्त, हफ्ता भर पहले। और फिर नीचे देखेंगे तो बॉटम रो पे, हाँ, ये जो है ये लॉबी का सीन है, जहाँ पे हम एंटर करते हैं, ब्यूटीफुल लॉबी। और ये देखिए ऑन द इनॉग्रेशन डे 300 लोग यहाँ पे बैठ के और वीडियो देख रहे हैं हॉस्पिटल के इंसेप्शन के बारे में। ये गणेश जी की मूर्ति है लॉबी में, ये एक मैप है। और नीचे देखिए, ये है क्लिनिकल लेबोरेटरी, जो है बहुत आधुनिक, बिल्कुल स्टेट ऑफ द आर्ट इक्विपमेंट के साथ। ये रिसेप्शन एरिया है और बस हम आभारी हैं, हमारा जीवन सफल हो गया, क्योंकि ये हॉस्पिटल बना है इस प्रिंसिपल पे, वेदांतिक प्रिंसिपल पे कि वासुदेव कुटुंबकम, कोई पराया नहीं, सब अपने ही हैं। जैसे गुरु नानक साहब ने भी हमें कहा है, बिसर गई सब तात पराई। जो पराया है, पराये की जो तात है, जो एसेंस है, तत्व है, वो बिसर गया मेरे से। अब सब मेरे ही अपने हैं, सब मेरे ही भाई बहन बंधु हैं।
बहुत अच्छा, बहुत अच्छी बात कही। That's amazing. It's beautiful. Not just what you said, but how you feel about the cause and the purpose. And let me tell you, Dr. Sani Anand is a very known doctor, physician at Stanford, and Stanford being one of the best premier institutes across not only Bay Area but America. So very inspiring, very motivating. And here is a chance for me to show you a video which will let you know more about the project. So let me share that video as well with you so that we can know how and what is happening in the hospital around that area, serving people and humanity.
थोड़ा expand करिए।
बिल्कुल, एक सेकंड बस। Give me 1 second. Yeah, there you go. Can you see my screen?
Yeah.
Perfect.
The current pandemic has overwhelmed India's healthcare system with acute shortages of oxygenators, oxygen supply, and ICU beds in rural areas. Delayed vaccinations have not even reached small towns or villages, with makeshift hospitals being opened in the cities. 1.5 million pandemic deaths are projected by the WHO in India. We are building a charitable hospital in the village of Mudenahalli, supported by mobile clinics and outreach services to women, children, and the elderly. Completely free services continue despite the pandemic lockdown, and this rural hospital will become a COVID care facility.
Amid the sharp rise of COVID cases and the growing demand for hospital facilities, especially intensive care and oxygen beds, during the first phase, the 63,000 square feet hospital will offer 125 HDU or high dependency units and oxygenated beds and 25 intensive care unit beds absolutely free of cost. In the second phase, another 150 beds will be added. The Sri Sathya Sai Sarla Memorial Hospital is scheduled to commence its free COVID services to the nation by the end of July 2021 and will provide healthcare and succor by encompassing a holistic approach that will treat both the physical and mental aspects of every single individual in need.
The current pandemic shows this is a critical safety net hospital delivering advanced healthcare free of cost to the poorest rural populations in these underserved areas. These dedicated doctors and nurses have done similar work for almost 70 years, where each penny goes much further and reaches the poorest people without any administrative costs.
That was so touching. That was so relevant to our lives, and to know about it was really a treat to us. Thank you so much, Dr. Sania Anandji, for bringing us that information and for that video. I appreciate it. एक बार जोरदार तालियां, huge applause for Dr. Sania Anandji and for all the efforts that he is doing. Thank you so very much. And now moving forward, we'll present a song by Manjari ji. We would like to, for all of you to know about how we feel about this cause as Bay Area residents, as people in America, far away from our homeland. Let's hear to this music and enjoy and think of how blessed we are and what we can do. It's not what we have, but what we share with others makes so much of difference. So Manjari ji, welcome to Srijani.
इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना। इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना। हम चले नेक रास्ते पे, हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना। हम चले नेक रास्ते पे, हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना। दूर अज्ञान के हो अंधेरे, तू हमें ज्ञान की रोशनी दे। हर बुराई से बच के रखे हम, जितनी भी भरी जिंदगी दे। बैर होना किसी का किसी से, भावना मन में बदलने की होना। हम चले नेक रास्ते पे, हमसे भूल कर भी कोई भूल होना। इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना। सोचे हमें क्या मिला है, हम ये सोचे किया क्या है अर्पण, फूल खुशियों के बाटे सभी को, सबका जीवन ही बन जाए मधुबन, अपनी करुणा का जल तो बहा के, कर दे पावन हर एक मन का कोना, हम चले नेक रास्ते पे हमसे भूल कर भी कोई भूल होना, इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना। हर तरफ जुल्म है, बेबसी है, सहमा सहमा सा हर आदमी है, पाप का बोझ बढ़ता ही जाए, जाने कैसे ये धरती थमी है, बोझ ममता सके तू उठा ले, तेरी रचना का ये अंत होना, हम चले नेक रास्ते पे हमसे भूल कर भी कोई भूल होना, इतनी शक्ति हमें देना दाता, मन का विश्वास कमजोर होना।
Beautiful, beautiful, amazing. Thank you, Manjari, for bringing that spirit. And the song itself says, हम न सोचे हमें क्या मिला है, हम ये सोचे किया क्या है अर्पण. So whatever we give comes back to us manifold. That is called biokarma. So to make some karma points, we are trying today to understand how this is possible, how this hospital came into being, and if we can replicate the same model across all cities, all हर गली, हर मोहल्ले, हर कस्बे, हर शहर में, हर राज्य में, क्या हम ऐसा कर सकते हैं? ये सवाल हमको आज स्वयं से, अपने आप से पूछना है. तो हमारे साथ बहुत सारे, we have a lot of audience today connected with us. Sunita Verma ji from California, Avdesh ji from Madhya Pradesh, Jitu Goyal ji, Saurabh Shukla ji, we have Dattatreya Hebur ji, I'm not sure where he's from, but he seems to be very excited about all the comments he's making. Rohit Ramesh ji, such a great initiative he told. Let me actually show as I'm speaking. Ilsa Clearwater, I believe this is a non-Indian person, but she's still appreciating. So I'm with Ganesh Datta ji, we have Jugesh Anand ji, Veer Bahadur Chauhan ji, we have Satya Begapalli ji, and we have Ashok Pruthi sir, and Surendra Sarthak ji, Suresh Chaudhary ji. So and I'll keep on adding the names as we have all our audience appreciating all that you all are doing. Thank you, Manjari ji. Thank you, Dr. Sunny ji. So moving forward, let's have a few more questions and let's try to understand how the project is happening. So we would like to invite Sundar Kamath ji, who is very much involved, who's having a lot of knowledge about this. So Sundar ji, how much of a project budget? Like, let's talk about finances, which is the basic, jo Aadhaar Stambh hai, which is the need, jo bunyad banti hai. How can we make this happen? How did this all project came into being? What are the numbers we should know about, and how much is still expected, like ETA, the amount, the date, and how every city can replicate this model? Would like to know everything that we should know about this project. Welcoming to Srijani's platform, Sundar Kamath ji. We are very happy to have you with us today.
Om Shri Sai Ram. So it was a beautiful song, by the way. Really enjoyed it. And Archana ji, this is a fantastic program. We all appreciate what you're doing for the community. As Dr. Sunny said, this truly is a divine project. We are just the instruments. He is making it happen. And it's a miracle how quickly this hospital has come up. As Dr. Sunny said, the plan was to have 150 beds. And when you look at the total cost of the construction, the equipment, the oxygen plant, the facilities, for those 150 beds, it comes to approximately $22,500 per bed, the entire project, which is about 16 to 17 lakhs in Indian rupees per bed of all the cost. And by His grace, we have been able to raise funds for 130 beds from India, US, from all over the world. And we have 20 more beds to go, which means we have another about 400,000, 450,000. And donations have ranged from $100, $50 to several tens, hundreds of thousands of dollars. So any amount is, of course, acceptable. It all comes from the heart. And so we have 20 more beds to go, which we would like to fund within the next month. The hospital has completed the ground floor, and one more floor is getting finished by September. And by that time, these beds will be in place. So whatever help people can do, even spreading the awareness, letting people know, that's what we're looking for.
Perfect. Sounds great. And also, we would like to know, besides financial support, how can people connect and help in the project, in this noble cause?
Sure. So I think the most important thing is spreading the awareness of the project. The rural population, if you take this district, this is called the Chikbalapur district, which is outside Bangalore. It's on the way to the Hyderabad, on the highway, off the national highway going to Hyderabad. And the district has about 1,500 villages and about 1.3 million people. It has only one district hospital and 4 taluk hospitals. So the capacity is extremely inadequate. And our hospital, the Sathya Sai Sarla Memorial Hospital, will meet the needs of a lot of these villages. We are going to provide transportation for the villagers to come to the hospital. We have a mobile medical unit that goes to the villages and identifies those who need hospital care versus those who can get the medicines in the village. And India needs thousands of these hospitals.
True.
And the capacity is there. People have the money, companies have the money. So there is CSR projects also. People can talk to their company, CSR, corporate social responsibility. They can also provide donations, matching donations. So there's many, many ways. You can talk to medical companies if they want to donate equipment for the hospital. That's one way. And so whatever you wish to do, we are open to it. Any help is welcome.
Thank you so much, Sundarji. I think that was very informative for all of us to know, so that we can also try from wherever we are, from whatever we are in our position, in our limitations, we can at least try, put a little effort. As they say, Gilhari Prayas, a squirrel effort, the small animal that Gilhari is, but that Gilhari also wanted to help in a positive way. So I always have this question in mind that if my grandchildren ever ask me during pandemic, during lockdown, during difficult times, what were you doing? Where were you? What was your contribution? At least I can look at their eyes and say, I did this much, but I did this much. So that is very important to know that what you are doing, and you don't have to justify anybody else but to you. When you look at yourself on the mirror, in your eyes, you can look straight and answer yourself. So as I say, alone I can say, but together we can talk. Alone I can enjoy, but together we can celebrate. Alone I can smile, but together we can laugh. And that's the beauty of being together. We are nothing without each other. So let's put that power, the strength of togetherness, and make things happen for tomorrow. I mean, if not for today, at least for tomorrow. In coming times, we need to have some memories that will make us happy, to look back, the joy. So let me now welcome B.V. Jagdish sir and Anu Jagdish ma'am to please come up stage and help us understand, because they are quite close to us. They are like us. They are us. So we would like to know, because sometimes we say, बहुत easy है बोलना, but करना बहुत मुश्किल होता है. वहाँ जाना, time to spend time there and invest your efforts, your time, your mind. I mean, everybody is busy in their own bread and butter of life, creating a web. So many things to happen, so many things to do. But how do you make time for a project, for a mission, for a dream? That's important. That's your good karma. So let's welcome B.V. sir and Anuji and ask them what was their impression, what was their thought when they went. Actually, they have been there, lived there. I mean, that's not just a checklist, but it's actually happening that they have been involved in the project. So welcome Anu ma'am and B.V. sir, and we would love to know, how did you feel when you saw this project happening in real life? They've been involved from the start, so would love to know their experience, first-hand experience about this project. Welcome, Anu ma'am. Welcome, sir.
Archana ji, thank you so much, and very good morning for organizing this amazing program, and I think bringing together a lot of people here to spread the awareness of this wonderful cause that is done by the Sarala Hospital and the Sai Initiative all over Karnataka and all over India, as a matter of fact. And we happened to be there about 3 months ago in India, just at the time when the second wave was about to hit. And we were also very fortunate to visit the center and appreciate and see firsthand ourselves. And I have to say that the cause and the way the spiritual leaders and the organizers and everybody think about solving this problem is really, really remarkable. I mean, we all have been watching, right, ever since the pandemic got hit, especially in India. You know, everybody is rushing to send oxygen concentrators, send PPEs and various other equipments and things like that. But this is the first situation where we saw that you're building a hospital that is actually going to last for a very, very long time. I mean, actually, that's what inspired us. So it's not just a one-time thing where you send some concentrators and then be done with it. So this is a hospital that is going to serve the mankind, not just today, but for a very, very long time. And that vision, what appealed to us, and when we visited that place, and the fact that, you know, this hospital doesn't even have a cash counter, right? As we all know, hospitals today are completely driven based on business needs. And here is somebody who is building a hospital with no intention to charge any money at all from anybody. Whether you are rich or poor or anyone, you can walk into the hospital and get a 100% free treatment. And we were absolutely stunned with the motive of how this organization has come together to solve. And if you look at the overall theme of this organization, the theme is very simple. It's love all, serve all. And when we asked this question to the spiritual leaders, you know, we were blown away with the answer. Essentially, they said, if you think of your own family members, your own children, if they fall sick, what would you do? Would you ask them to pay money? You would do anything possible. You would beg, borrow, and pull your bank balance, whatever you have, to make sure that your family members are treated properly. And the way they look at is, as Dr. Sunny Anand was saying, Vasudhaiva Kutumbakam. Basically, they look at everybody in this world, you should look at them as your children. I mean, if you are in a very fortunate situation, whatever that fortunate situation can be, right? You may have $10, you may have $100, you may have $1 million or $1 billion. It doesn't matter. If you have that extra money and extra time that you want to offer, then you start looking at everyone else as your children. And when you look at others as your children, then you just step up and start to help. I think that was the absolutely moving thing for us. And we were really, really blown away with the way how this organization operates and how they want to continue to offer free, 100% free services. And to what they say, they have not just saying it, but they have actually executed, they have delivered it. And by the way, this is not the only project that they're working on. You know, Sunil Gavaskar is behind another initiative by exactly the same spiritual organization called the Heart to Heart Foundation, where they have built a massive hospital, again, 100% free, to provide pediatric and for children, cardiac care for children, completely 100% free in Mumbai, which is the most expensive place in India. And Sunil Gavaskar is behind this. So there is a lot of celebrities, a lot of people are behind this to make this cause to help bridge between the haves and the have-nots. And we are absolutely excited to be part of this. Great to see an initiative by Dr. Sunny Anand and Sundar Kamath, how passionate they are. I want to have my wife Anu, who also joined me, and her parents as well, who joined from Bangalore when we were there at this Mudenahalli campus. I want her to add her views as well.
Welcome, welcome, Anuji, welcome.
Yeah, thank you very much, Archana ji. So basically, I think two things strike me a lot. One is, whether it's COVID or cancer, it does not discriminate between people who have money and who don't have money. And the plight of the people who don't have money is pretty much they give up. At that point, they decide to stop taking care of them because they do not have the means. And I think it's an incredible service that, now there is hope and opportunity for these people. So that's what kind of like inspired me that, we were there during the pandemic times. People who had access to resources could not find hospital beds, could not find oxygen concentrators. Then imagine those plight of those service people who do not have contacts or the resources to get medical care. And I'm so grateful that this opportunity is being provided to the people who don't have resources. Second of all, I'm born in Chikbalapura, and I come from the Chikbalapura district where this hospital is located. Even many years ago, I think even since like the last 40-50 years, the resources and the quality of care has not improved there. Anybody who gets sick, they have to come to Bangalore to get the best treatments. And if there was competent medical care and resources, I think my grandfather would not have passed away. He passed away because he did not have access to competent medical care. So there's many people in our family who have suffered or have been affected. And so I'm really grateful that a very competent system is being created for the people in that region. And I would say it's wherever we are in life, whether it's through dollars, it's through connections, it is through, we all owe it to make this world a better place. However you can, join stream whatever cause that you connect to, and help in whatever way you can. That's the philosophy I believe in. Thank you.
Wonderful belief, Anuji, and I'm very impressed about how you're trying to help. As they say, "Bazi laga du jaan ki, main beti Hindustan ki." You being a daughter of India and giving back something to your own motherland, in your own village, in your own, जो कहते हैं अपनी मिट्टी को कुछ वापस दे पाना. That's such an amazing thought. And we are joined by Pavan Kumar Reddy ji, who are saying amazing cause, free of cost hospital with best quality healthcare. They're impressed, and thank you, Pavan ji. And Dr. Shilpa Shilpi ji is joining from Germany, and she's really impressed, and she wants to know how she can help. So Dr. Shipra from Germany wants to know how we can help. That will be our next question. But let me first appreciate all the audience. We have Meenu Puri ji, who is a wonderful singer of the Bay Area. Thank you, Meenu ji, for watching the show and for appreciating and encouraging. So we have Pavan ji, Shipra ji, Meenu ji, and also Prachi Randhawa ji from Canada. She is asking, how can we contribute? And excellent work for all the volunteers who are doing. So now with all these questions, Rachna Tiwari, Avdesh Prasad, Manjuri Kalvi ji also is writing, Sandeep Relan ji, and then we have Saurabh Shukla ji. They all want to know how they can connect with the cause and how they can donate. So that would be my next question, Anuji and Vivi sir or Sundar sir, whoever wants to help me to understand how people can connect and do something for the cause. That will be great. And Rashmi ji says respect. Of course, we all have a lot of respect for all people who are doing selflessly. Niswart bhav se seva. As I said, Manav seva hi Madhav seva hai. We don't pray when we just go and bow our head. We pray when we do good thing, goodwill for the world, for humanity. So thank you. And my question to all of you, whoever would like to pitch in, would be how and where we can connect with the cause, with this project.
So this institution is established as a non-profit organization, and in the US it's a 501c corporation, and in India it's ATG, where any amount of money that is contributed towards this cause is tax deductible. I would request Sundar Kamath to give the exact name of the charitable organization in US and in India.
And I would also say, let's give a couple of emails where people can connect with the cause and help, volunteer and others. So I think it'll be great if you can put that in the chat, Sundarji, so that people know and we can share it with the Srijani audience.
Awesome. Great. Yes, that would be the website, email, any contact, any point of contact that you can give in a short message that our audience can connect with. That will be greatly appreciated. So here, Sundarji, we would love to hear from you, Sundarji.
Yes, as our baby Jagdish just said, we have two non-profits, one in India, one in the US. So whatever contributions are made are tax deductible. When the next song is happening, I will post the address of the organization for people, and of course all your audience, if they're connected with you, Archana ji, they can always contact you, and you can also be one of our focal points in this. But I will post it when the next song is happening.
Sure, and that reminds me, we have a beautiful song coming right ahead by Sharvari ji. Sharvari ji is one of the leading singers of Bay Area. Very proud to have her in this group, and thank you so much, Sharvari ji and Sharvari ji, for joining us on the beautiful song. So yes, very you.
Thank you so much, Archana ji, and everybody here. Let's listen to the song. हमको मन की शक्ति देना, मन विजय करे, दूसरों की जय से पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों की जय से पहले खुद को जय करे। हमको मन की शक्ति देना। भेदभाव अपने दिल से, भेदभाव अपने दिल से साफ कर सके, भेदभाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच का दम भरे, झूठ से बचे रहे, सच का दम भरे, दूसरों की जय से पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों की जय से पहले खुद को जय करे। हमको मन की शक्ति देना। मुश्किलें पड़े तो हम पे इतना कर्म कर,
साथ दे तो धर्म का, चले तो धर्म पर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला धरे, बदी से ना डरे, खुद पे हौसला धरे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Wow, Shadwari ji, amazing, amazing, amazing. What a beautiful voice and such a great message. I truly appreciate that, the message. खुद पे हौसला रहे, बदी से ना डरें. Beautiful. And we're also joined by Dhaval ji at this point. Dhaval ji, welcome to Srijni and welcome to the making of Sarla Memorial Hospital. हम इसमें ना सिर्फ हॉस्पिटल बना रहे हैं, बट यादें बना रहे हैं अच्छे कामों की. As I say, good karma points. That's what we are doing at this moment of time. But at this moment हम invite करना चाहेंगे डॉक्टर सनी जी को फिर से. कहते हैं जैसा मन है वैसा मंजर होता है, मौसम तो इंसान के अंदर होता है. Whatever we think, whatever we envisage, whatever we dream of, we put in action. Our implementation only goes till the point we can think of, we can dream of. जी हाँ, ख्वाब जिनके ऊंचे और मस्त होते हैं, उनके इम्तिहान भी जबरदस्त होते हैं. It's not easy. I never said it was easy. And I love the smile, Dr. Sunny. इतने अच्छे आपने, you are happy, and that's what makes everybody happy around you, because that वो छलकता है, it oozes out from you, it comes from within. वो दिल से आता है, दिल तक पहुंचती जरूर है. तो आइए इस बात करते हैं डॉक्टर सनी जी से. We would love to know little more about it. I know it's a very short time, it's a compact program, but whatever our audience can know about the project, we would love to hear from you, Dr. Sunny. Welcome again to Srijni.
Archana ji, I just wanted to mention, I had been looking at the numbers of people dying in Chikbalapur, and the district was the very first district in all of India where they ran out of ICU beds. Even early in May, just when the second wave of pandemic was hitting its peak, Chikbalapur ran out of any kind of ICU beds. And अगर ये हॉस्पिटल अप्रैल में बन गया होता, May 1st को अगर तैयार होता, then 60 to 70 lives would have been saved every month. अब आप सोचिए इसका कितना असर है. 60-70 lives every month for each bed that is in the hospital. So the impact would have been phenomenal. And I feel that, भगवान ना करे कि थर्ड वेव आए इंडिया में, जो रूरल पॉपुलेशन है वो तो कहीं की नहीं रही. और इसलिए हमारी हमदर्दी, हमारी सोच होनी चाहिए कि उनकी कैसे सबसे ज्यादा मदद हो सके. जो शहरी लोग हैं, जो पढ़े लिखे लोग हैं, उनको तो कहीं ना कहीं रास्ता मिल ही जाएगा, वो ढूंढ लेंगे. बट जिनके पास कुछ नहीं, जैसे अनु जी ने कहा, जिनके पास कुछ भी नहीं है, वो फिर क्या करें?
That's such an important and timely question. वो फिर क्या करें? I mean, what and what? That's what is reverberating in every mind and every. सच कहा आपने बिल्कुल सनी जी, आपका सवाल बहुत सटीक, सुंदर और सार्थक है. Very, very pertinent question at this moment. What will they do? क्या करें? Unless they have a hospital like this to go to. So to make this happen, that is what we are trying. We all are endeavoring, trying to make not only in one city, one state, but if we can replicate the same model everywhere, and that's a dream, and keeping fingers crossed that we can what we think we can. So here we would like to invite anybody, Sundar ji or Anu ji, BV sir, if you want to share some more information about it, we would love to hear. But Sunny sir, एक बात आपसे कहना चाहेंगे कि I didn't expect, आप इतनी अच्छी हिंदी बोलते हैं, having lived here for all your life, but still आपने इतना अच्छा हिंदी बोला. एक बार तो जोरदार ताली आपके नाम पर for the language, for the beauty of language that you're bringing. Amazing. And let me tell you, Sundar sir is a very renowned person in Bay Area. बहुत बड़े इंसान है, but बहुत ही humble है, down. And I think all of you, I'm so honored to know BV sir, Anu ma'am, Sundar sir, Dr. Sunny, everybody. So much to learn from all of you. And also thank you so much all our great singers, Sarwari ji, Manjari ji, and we'll hear now from Dhaval ji as well. तो सनी सर आपसे पूछना चाहेंगे कि आप इतनी अच्छी हिंदी कैसे बोल पाते हैं?
जी मैं बड़ा हुआ था मध्य प्रदेश में फ्रॉम द एज ऑफ अबाउट 10 to 18 और वहाँ पे न्यूज़पेपर पढ़ता था रोज, नवभारत टाइम्स, इंदौर जगह थी, सो वहीं से। और हमारे बच्चे जो यहाँ पैदा पले हुए हैं वो भी हिंदी बोल लेते हैं, समझ लेते हैं, उनको भी यही परवरिश घर में दी गई।
Very nice. Thank you so much. And just for all our audience knowledge, इंडिया में अगर आप हैं और कहीं पर भी हैं, you can send an email to krishna.subhaga@sslsg.org. I'll also provide this in the comment section of our video posting. But just to listen, it is krishna.subhaga@sslsg.org. Or you can also send an email to saigmfoundation@gmail.com. So we have two emails that you can connect with us. I'll also put this same information in the video posting. And also in the same time, I'll take this opportunity to appreciate Usha Prabhuji, who's from Bay Area, who has told thank you for the dedication and service. This is beautiful message that she has sent. Thank you, Usha ji. She is Shivankari's mom, and both of them are great singers of the Bay Area. So thank you, Usha ji, for joining and appreciating the effort. We also have Satya Bagepalli ji, who belongs to Chikbalapur too, and he says he's glad that you mentioned about the non-availability of good hospitals with Sarla Memorial Hospital. We all will have good hospitals. So people are watching and appreciating the effort that you're making, Anu ma'am. So very, very happy about that, the work that you're doing. So Jugesh Anand says appreciates the music part. The Rashmi Sinha is very happy. Thank you so much for joining us on this Sunday morning. I know it's tough, but it makes so much of a difference. And time for another music break. We'll request Dhaval ji to please come up stage and present his lovely song. Dhaval ji, welcome to Srijani.
Hello, testing. Archana ji, is it good?
Perfect.
And just the music. Okay?
Great.
Okay. Hello, everyone, and good morning, good evening, good night, good afternoon. It's going worldwide, and such a wonderful program Archana ji has put together, and such wonderful things I've heard from Dr. Sunny Anand, Dr. Kamath, Anu ji, BV ji, and beautiful singing by Sharwari ji and Manjari ji, and topped by the comparing of Archana ji. Thank you very much. So the song I'll be singing is Kisi Ki Muskurahaton Pe Ho Nisar, originally sung by Mukesh and acted by Raj Kapoor.
And I should add here, such a lovely song is very close to my heart and very meaningful. From one light, we can light thousands of candles. And similar way, when Dhaval ji sings, we really can enlighten a lot of hearts. Thank you, Dhaval ji, for making time to sing this beautiful song. Welcome.
Sure. My pleasure. किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है। माना अपनी जेब से गरीब हैं, फिर भी यारो दिल के हम अमीर हैं। माना अपनी जेब से गरीब हैं, फिर भी यारो दिल के हम अमीर हैं। मिटे जो प्यार के लिए वो जिंदगी, जले बाहर के लिए वो जिंदगी, किसी को हो ना हो हमें है एतबार, जीना इसी का नाम है। रिश्ता दिल से दिल के एतबार का, जिंदा है हम ही से नाम प्यार का। रिश्ता दिल से दिल के एतबार का, जिंदा है हम ही से नाम प्यार का। कि मिट के भी किसी को याद आएंगे, किसी के आंसुओं में मुस्कुराएंगे। कहेगा फूल हर कली से बार बार, जीना इसी का नाम है। एवरीवन, किसी की मुस्कुराहटों पे हो निसार सिंह,
किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते होते दिल में।
जीना इसी का नाम है, जीना इसी का नाम है, जीना इसी का नाम है।
धमाल धमाल बेमिसाल, आप तो दुस्त छा गए धवल जी। Amazing song, great, great, great. So we are just left with 2 minutes, and we'll wind up. We started on time. We'll wind up on time to respect the time for everybody. And we are very glad to have so many audience appreciating the music and the effort of all the volunteers. So we have Ganesh Dutt ji, Geeta Dwivedi ji, Dr. Shipra Shilpi ji, and we have Prachi ji. We have Rashmi Sinha, Jugesh Anand, Usha Prabhu ji, Satya ji, Meenu ji. Thank you everybody for joining us on this show. So if anybody has anything to add for our audience, this is your chance. And before we say adios, namaskar, bye-bye, any information, any addition that we have missed out, please welcome to share your words and your thoughts.
I think if we all look at the concept of Sarve Jana Sukhino Bhavantu, which is what we all believe in, especially in India, if we go with that concept, whatever help that we can provide, I think it will go a long way. And this is just the beginning of some wonderful work that is being done by this organization and many others, thousands and thousands of people who are trying to help to solve this once in a century kind of a problem that the entire world is facing. So let's all stand up and do whatever help that we can do to save lives. And thank you, Archana ji, for this incredible program that you have organized to bring together, I don't know how many thousands of people who are watching this, but the awareness that you are creating and hoping that this would lead to completion of the remaining 20 beds is the goal for all of us here right now. Thank you.
Very well said, sir. Thank you so much. Anuji, Sundar sir, Sunny sir, any addition that you would like to make before we say adios?
I really appreciate your willingness to bring this cause to the forefront, and just wanted to also add that those who cannot do anything, either financially or by creating awareness or anything, they can always say a prayer from the bottom of their heart for the poor people in the villages, and that prayer itself will be powerful. Yes, if you have even a penny to spare, that will go a long way towards saving lives and the blossoming of life happening because of you, because of your efforts and your contributions.
And the last message from me is love all, serve all, because everyone is divine.
Aha, that is a divine message itself. Very nice. प्राणों की कस्तूरी है, वैक्सीन बहुत जरूरी है. So to all my friends, family, near and dear ones, make sure that you're vaccinated, be it here on India, anywhere in the globe. we really request to urge you to get vaccinated to be safe on the safer side. And वो जैसे कहते हैं, दिया खुदा ने तुम्हें है ये किस्मत, आके यहाँ हो बसे, खोना ना मिट्टी से रिश्ता वो अपना, पश्चिम तुम्हें ना डसे, अपने खजाने से छोटी अठन्नी कर दे दो तुम दान में, मिल जाए तो कोई बच्चे को अवसर, बढ़ जाए वो ज्ञान में, माँ के कर्जे को कुछ तो चुकाओ, टैक्स बचाओ, पुण्य भी कमाओ. तो इतने कहना चाहूंगी, all the donations you give are tax deductible, and also it adds to your karma points. So as I said, if somebody asks you in later future, I mean after like 20 years, 30 years, 100 years, what did you do? You can say, I did something, and you will be proud of yourself. It's not for them, it's for you. What I'm saying is कि आज आप करेंगे तो कल आपका सुखद होगा, बहुत खुशगवार होगा. तो इसी भावना के साथ हमेशा याद रखिए, एक दुआ के साथ, एक प्रार्थना के साथ, एक अर्चना के साथ आज हम बाय बाय नमस्कार करते हैं. आँख कभी भी कोई गम से खारी ना हो, आँख कभी भी कोई गम से खारी ना हो, आस किसी की हालातों की मारी ना हो, दुआ हमारी मौला तुमसे बस इतनी है, दुश्मन के घर भी कोई बीमारी ना हो, दुश्मन के घर भी कोई बीमारी ना हो. Till we meet again on Srijini, take care, अपना ख्याल रखिएगा. इसी मोड़, इसी चौराहे पर आपसे दोबारा मुलाकात जल्दी होगी, शीघ्र. इसी आशा के साथ स्वस्थ रहिए.